And good evening, everyone. When the numbers are all tallied, it's almost all but certain Onondaga County in 2021, that's just through the end of September, will end up setting the record for deadly overdoses, set just last year.
And now there are fewer options for those struggling with addiction to get help. Tonight, we are hearing from former employees of Tully Hill Treatment and Recovery after it abruptly shut down its inpatient services and sent patients home.
The center blames a severe staffing crisis, but as News Channel 9's Madison Moore tells us, a pair of former employees say there's more to it than a nursing shortage.
Admitting you need help and deciding to get it is a big step for any addict. But the opportunity to receive that help was abruptly ripped away from inpatient residents at Tully Hill Treatment and Recovery last month.
It was sad to think that it had come to that.
Registered nurse Kathleen Fair was working at Tully Hill when the patients got the news. Less than 24 hours later, she resigned.
I had no intentions of leaving. Ever.
Neither did 10 other nurses who resigned. Former Director of Nursing Leanne Reinders said it was a decision she had to make.
I got to the point where I was begging for help.
They claim administration wasn't listening. They felt they had no choice but to quit.
If they'd have just ceased admissions at that point, they wouldn't have had to discharge all the patients. The nurses wouldn't have all quit if they'd have just, heard our words.
The lack of support from administration meant the patients weren't getting the treatment they deserved.
We could not provide the care that us as nurses were desperately trying to provide.
When we reached out to CEO Kathy Palm for an interview, we were directed to a statement from the Board of Directors, reading in part, quote, "We are writing today to affirm the Board of Directors' commitment to Tully Hill and its mission, and our continued confidence in the organization's leadership team, including Kathy Palm, our Executive Director."
That statement is a gross misinterpretation of what actually is going on at Tully Hill.
They say they're willing to return if Palm is removed. It's now been over 3 weeks since their request. In Tully, Madison Moore, News Channel 9.
We did not receive a response from the Board of Directors when we reached out for a comment. The website states the facility is actively hiring nursing staff and outpatient services continue to be provided.